Hi there, this is Josh Melson from the Division of Digestive Diseases at Rush University Medical Center. I'm here to discuss our paper in press in gastrointestinal endoscopy. The presence of small and diminutive proximal hyperplastic polyps are associated with higher rates of synchronous advanced neoplasia compared with patients without serrated lesions. So the background for this paper on proximal right-sided hyperplastic polyps is that the United States Multi-Society Task Force, in their latest update, does not consider those lesions to be lesions that one would have to shorten the surveillance interval on. There's been a lot written about how there's challenge with concordance and variability on pathology assessment between hyperplastic polyps of the right side and sessile serrated polyps. It's a pretty common finding. In our study of over 2,000 screening patients, we found that a serrated lesion inclusive of right-sided hyperplastics occurred in 26% of the time, and the majority of those, over 58%, were diminutive right-sided hyperplastic polyps, that is, right-sided hyperplastic polyps that were less than 6 millimeters. So it's a pretty common finding. We don't have great data on what the implications of what that means, and that was why we sought to pursue this study. So we set up patients into three groups. We set up a group that had the finding of right-sided proximal hyperplastic polyps that were less than 3 in number, and that were small, none of them were over 1 centimeter. So that was our right-sided hyperplastic polyp group. We had our group that had neither a hyperplastic polyp or a serrated polyp, and then we had those with just a sessile serrated polyp. And the endpoint that we were looking at was synchronous advanced neoplasia. Synchronous advanced neoplasia defined as a polyp over 1 centimeter or a polyp with high-grade dysplasia or with velocity, villus features of over 25%. So the main finding of the study is, if you look at this group of patients that have these right-sided hyperplastic polyps that are small, again, that USMTF does not consider meriting surveillance, that they in fact do have a higher rate of advanced neoplasia synchronously than those that don't. The group with the right-sided small hyperplastic polyps had a rate of advanced neoplasia of 12.7%, and the screening group without these right-sided hyperplastic polyps had an advanced neoplasia rate of 7%. So then we did an adjustment where we looked at our high ADR, or at least those that were achieving high-quality colonoscopy based on a ASGE recommendation of 25% ADR detection rates in their screening cohorts. So we have to exclude a few colonoscopists, and still found that held true, that there was this increased rate of advanced neoplasia synchronously in those with right-sided hyperplastic polyps. So, I think this finding has implications. It has implications in terms of looking at how we deal with diminutive polyps. So in the ASGE PIVI, there's a need for high confidence in defining these diminutive polyps. In our findings, we found increased rates of advanced neoplasia in hyperplastic polyps and sessile serrated polyps, as would be expected, as well in those that would have conventional tubuloadenomas. So if we're seeing increased rates of advanced neoplasia on the right side in all these diminutive lesions, it does beg the question as to whether we truly do need high confidence, or whether we should just simply remove these and treat these as neoplastic lesions. The strengths of the study is that this is a screening cohort. It was a large cohort. We showed inter-observer concordance, that our pathologists were able to differentiate right-sided hyperplastic polyps from serrated polyps with good accuracy. The limitations of the study, it's not powered to define differences in colorectal cancer rates between the groups. Ultimately, the most important decision maker in terms of defining surveillance intervals of these right-sided serrated hyperplastic lesions would be metachronous data. What's needed, I think the next step is a large prospective study that shows pathology concordance, that we are dealing with truly right-sided hyperplastic polyps and serrated polyps, and teasing out the metachronous advanced neoplasia and ideally colorectal cancer rates on follow-up between those groups. And then can we really have a good understanding of what the metachronous neoplasia risk is of these right-sided lesions. Thank you.